Thank you again, everyone, for joining us, as always, for another POPVOX Foundation Casework Navigator webinar. I'm Ann Meeker, Deputy Director of POPVOX Foundation, former Congressional Caseworker, former Congressional Casework Director, and grateful, as always, to everyone so much for taking the time to join us today, especially when we're in this moment where it feels like the pace of casework just truly never slows down. So I'm always grateful for your time. I hope this can be a little bit of a break, a little bit of a break from the phones. But we have a really, really special webinar today. So I'm going to go ahead and dive right in. So I am so honored to introduce Jeremy Dillard, former Senior Congressional Liaison for the VA's Office of Congressional and Legislative Affairs. I will say, please note that I am saying welcome and not introduce, because I know that many of you have worked with Jeremy in his previous role. This is a really full circle moment for me because I also worked with Jeremy in his previous role. We sent many of our most difficult cases down to VA's Office of Congressional Legislative Affairs. So and I had the privilege of working with Jeremy, although he probably doesn't remember that as a privilege in the same way that I do. But after he left VA's Office of Legislative Congressional Affairs, we've had a chance to talk a little bit in kind of a meta level about what does that role look like and what's kind of the other side of the table for handling congressional inquiries. So I have a whole new appreciation for the work that he did and the absolutely unique bird's eye view of casework that those congressional liaisons build. So Jeremy, welcome and thank you so much for being here.
Thank you. Thank you for having me. I appreciate it.
Absolutely. So today we're going to talk, we're going to try to do three things. We have a lot to get through today, so we'll see how much we can. First, we're going to talk in very broad terms about just with this unique opportunity to talk to Jeremy, how do congressional liaisons work? Just what does that look like? What is the structure? What's the workflow? What's the kind of chain of command there? And then we're going to talk about what does congressional casework data that comes through those liaison offices tell us about structural issues within agencies? Try to think a little bit about how can we use that data to inform oversight, try to fix some of these systemic problems that caseworkers handle day to day. And then lastly, we're going to come back to casework and really talk about just advice for caseworkers handling these cases, how to write effective inquiries, how to work effectively with the good folks in that VA office and other agency liaisons as well. So I know that we have both some casework and some policy folks joining us today, and I'm sure that we are going to have so many questions. So please, please, please feel free to make use of that Q&A function, drop your questions in at any point. We're going to save most of them until after we get through some big picture framing stuff, but then I will do my best to play traffic cop and make sure that we have a chance to get to everybody's. Cool. So if that sounds good, we'll go ahead and get started. So Jeremy, how do you become a congressional liaison? Is this a job you're selected for? Is it one that you apply for? And if you apply for it, did you have any idea what you were getting into?
It is one that you apply for. It's posted on USA Jobs when they're available. Every single person that we hired in the last decade was hired via USA Jobs. To follow up on your question of did I know what I was getting into? Yes and no. I had filed 2 congressional inquiries previously for myself as a veteran and then also as an employee of the medical center in DC. So I kind of knew what I was getting into. You never know what's going to happen in casework.
Perfect. That is the truest thing I've ever heard about being a caseworker. So what does that office look like? I know most of the caseworkers here have probably interacted with that office at some point, but just how many people are there? Where does it sit? What does that look like?
For all of OCLA, there's last time I heard there was 45 full-time employees in OCLA. They are split up between the teams that work with the Senate and House Veterans Affairs committees, as well as appropriations. And then everyone else is either on the outreach team or CLS. The outreach team takes care of everyone that's not on the committees, and they answer all policy and legislative questions. And then CLS, the casework team, they take care of all casework issues and can advise on what policies are being used and what legislative priorities are being used at that point for those specific cases.
Got it. And so then how many people were on that casework team when you were there?
When I started, there were 9 people on the casework team. That included the deputy director. When I left, there were 4 people, including the deputy director. And I believe that's where they still are today.
Okay. So we're going to put a pin in that and come back to that later for what that means about the speed of congressional inquiries being worked.
Right. And well, let me also, I
Sure.
guess, kind of go somewhere with that as well. When I started 9 years ago with OCLA, we were receiving about 20,000 inquiries per year. And when I left, we were receiving 60,000 inquiries per year. So steadily over the last decade, they have cut caseworkers from the secretary's office and focused those FTEs in other places.
Got it. So again, the number of inquiries, I just want to make so clear, to make so clear that everyone understands this. So the number of FTEs available to work on casework has halved, is almost more than halved. And then the number of inquiries coming in has tripled, more than tripled.
Yes.
Okay. All right. So there's a problem there.
Yes. Yes. And that's why all these cases are backing up.
Yeah.
There's just not enough people to enter them.
Definitely. But at the same time, again, from you and I talking about your experience there, it sounds like there have also been some changes in modernizing that process for how VA handles those inquiries. So there's a little bit of mitigating tech there. But can you talk about just some of that modernization and how VA works those inquiries differently?
Yes. So in 2015, when I started at OCLA, they were printing out every single inquiry and writing on it where it needed to go to, and then hand it to an administrative person to scan back into the computer system as a PDF attachment, and then enter it in a computer system to push it down the line to be worked. We got rid of the printing that everyone was doing and just started moving emails over so that we could upload those into the computer system. That saved us about $2,000 to $3,000 in the budget quarterly, just because we weren't purchasing all that paper anymore. And then in like 2015 to 2016, that's when we started stopped printing inquiries. In 2014, we started logging everything so that we keep up with who an inquiry was assigned to, and then also we could put in the case number so that we could keep track of everything, and we would lose inquiries. Before I started in 2014, they were losing inquiries because they weren't keeping track of them. So that's how we started mitigating that issue. When I became acting deputy director in December of 23, I slowly started making changes and collecting data in Salesforce and changing the computer system as much as the secretary's office would allow, so that I could start tracking everything and figuring out where our problems were in the system. I also changed it to where the 4 people that I had working, or the 3 people that I had working with me, including myself, all had portfolios, so that they could state what was happening in their section of the country with specific hospitals, with specific regional offices, National Cemetery Administration issues in their regions. And those portfolios were broken down by congressional offices and senators, excuse me. Most of the staff liked that, just because they had a better grasp on what was going on, and they could build relationships with their caseworkers in the congressional offices. They also liked being able to have more conversations with those congressional or caseworkers and just explaining, hey, this is what I need from you to have a good inquiry that's ready to go. And then also help them navigate, okay, this doesn't specifically need to come to the secretary's office. You should start at the regional office level or at the local hospital level. So they were able to have those conversations with people, and we were going to try to build on that. And then things changed.
That's fair. And let me also, just for context and framing here, I think I should have set up front. So Jeremy, you left the office in September of 2024.
Yes, correct? I left September 12th. That was my last day. On my last day, we had 860 open cases in the computer system, and 299 of them were mine.
Wow. So just a little bit of context and level setting for the folks on the call who handle their own caseloads, that is an incredible number of cases to work at any given time.
Yes. Yes, it is.
Okay. So that's all really helpful context for just understanding what's going on when you send those inquiries down to OCLA, thinking about the time frame for getting them answered. Um, and I want to dig in on that a little bit, your point about the portfolios, that part of your former role that I don't think I'd really understood was also in liaising with the other business units of the VA that are also responding to congressional inquiries. So you mentioned the local hospital systems, the regional offices, processing centers. Can you tell me how that worked?
Yes. So when we get a congressional inquiry in, typically 95% of them, I would say, go to the local level first. We wanted to understand what the problem was at the local level and make sure they were operating under current legislative priorities and also policies. Sometimes we would catch stuff that we could fix and navigate, and sometimes we would have to escalate it to the VISM level and ask the VISM leadership to address these issues, or above the regional office level as well for VBA issues. At times, we would escalate things all the way up to an undersecretary or the secretary themselves.
Got it. So I think I'd kind of understood this when I was a caseworker, but again, it's really hitting me more now, just that the congressional liaisons within that VA office, the Office of Congressional Legislative Affairs, have an absolutely unique, really genuinely bird's eye view over every component of how the VA operates and are
Yes,
used to troubleshooting and problem solving for each one of those different components.
correct.
And
Correct.
then also direct line to all of these members of Congress and their staff who are submitting these inquiries and the
Yes.
committees.
Yes.
And then also to VA leadership as that changes under each successive administration.
Yes.
So
That's true. We
just,
work with everyone.
yeah. So what an absolutely mind-blowing bird's eye view over how this works and where the problems are.
Correct.
Cool. Okay. So then we've talked a little bit about just what those trends are. So as congressional offices are submitting these inquiries, as you're working these, there are kind of always going to be some buckets of inquiries where you're just going to get inquiries. Folks
Right.
are not satisfied with the timing. It's just a tough process. But then you and I have also talked a little bit about how you use that data to track some issues that were kind of more under the radar. Can you just tell us a little bit about what stood out to you in those trends?
Sure, sure. So a lot of issues that I would find, of course, we know about claims. Oftentimes people are saying, hey, what's the status of my claim? What's the status of my claim? We get those all the time. But in the trends, what I found were like pension and aided attendance claims were a major issue. We only had two, so during the Biden administration, they reduced the amount of regional offices that work these claims from 3 regional offices to 2 regional offices. Most of these claims, the veterans or their dependents that are requesting help with these issues already meet the qualifications to have them expedited. They're already, pension claims are for people that make less than $1,800 a month or at the poverty level. They oftentimes are requesting help because they're going into a nursing home and they're about to be evicted from a nursing home at times. And I don't know about you, but I don't want to see veterans or their dependents evicted from nursing homes because VA takes a year to a year and a half to process a pension claim or aid in attendance claim. So, you know, and then also another way to expedite is by having advanced age. Well, most of these people, if they're going into nursing homes, they're advanced age. So the administration then decided to take away people from working these claims and focus them on other places. And, that's a problem. Further issues that we see or that we were seeing were the disruptive behavior flags. There's not an appeals process for people that are placed on a disruptive behavior flag, and it seriously impacts their medical care. It impacts their ability to move around the VA facility freely without having someone from security follow them around. And these people really need an appeals process to go back and see if, maybe the employee was having a bad day. Maybe the employee and the veteran have had a past experience. So those are 2 problems right there. Records Management Center, that was a major issue. We always received, requests from caseworkers to help get records. Well, the system is antiquated. We're still printing off, records onto CDs. The computer I just bought when I left the VA doesn't even have a CD-ROM on it, and it's a top of the line Mac. And like these things are common sense problems with common sense solutions. And for Records Management Center, I actually went to the Heidi, who is the special advisor or senior advisor to the Veterans Benefits Undersecretary, and said, hey, these people can't access their records online, and we're advertising that they can get them online. And she didn't have a clue that the records weren't available on va.gov for people to download, and that they're going via CDs through the mail and they're getting broken in the process. And then we have to start the process all over again for the veteran. And who's paying the price? The veteran.
Right. Absolutely.
Again, common sense issues that, quite frankly, if we uploaded everything into the computer system, we're going to save money on buying CDs and mailing them out.
Yeah.
Office of General Counsel is an issue. And please, if you need to interrupt me, please do.
Well, actually, what I'd love to
go ahead.
I definitely want to get to Office of General Counsel because I know it's going to involve Privacy Act release forms and like, let's go. But the thing I want to just like flag here is, so you're talking about on some level, kind of this casework data being used within the VA to help out with oversight. So then we're also thinking about just how is this data informing congressional oversight on that side as well. So actually on a wonderful suggestion from my colleague, Aubrey Wilson, I printed out the House of Representatives Committee on Veterans Affairs 119th Congress Authorization and Oversight Plan. And I'm really struck by just how many of the trends that you've identified, maybe some others that we can get to, are almost directly connected to the agency's roadmap for oversight, or the committee's roadmap for oversight in the 119th Congress. So we're kind of trying to match up the data that already exists that's coming into the agency from Congress with the agency's stated priorities for oversight.
Correct.
Yeah.
It in a lot of ways aligns with the data that I found from congressional casework. And I think they should request a congressionally mandated report on the casework that's going into the secretary's office so that they can better utilize that information for policy and legislative planning. Because I've seen legislation that has passed and policies that have passed that have negatively impacted veterans. So, and sorry if I'm streaming off a little bit here, but years back in like 2017, I actually had a veteran that had esophageal cancer. Well, esophageal cancer was a presumptive for Vietnam veterans or Camp Lejeune for VHA, but it was not at the time a presumptive for Veterans Benefits Administration. So this veteran was receiving care from Veterans Health Administration and bills in the millions of dollars through community care that we were working to get him paid out, but he wasn't receiving any monetary benefits from Veterans Benefits Administration because we did not create the legislation and the policy correctly so that was a presumptive for both sides. Now, hindsight 2020, they fixed that in the PACT Act. Thank you. But by the time that was fixed in the PACT Act, the veteran had already passed away, and it was 5 years after his death that his widow received the benefits. I don't believe that's acceptable.
Right. And so that describes like the feedback loop that in an ideal world, we'd love to see happening with legislation all the time, that no law can kind of foresee all of the possible unintended consequences, all of the edge cases. And so casework is the way that we find those edge cases and we find the issues. And then ideally there's that pipeline that goes from casework back to legislation and then fixes those issues, and that goes forward. But there's a piece in here too that I think where your experience and your insight into how the VA works is so critical, which is understanding what's actually within that legislation that's causing the issue. And there's one of these that shows up in this oversight plan that you and I had talked about that I wonder if you could just touch on, which is over and underpayments are a huge subject of oversight right now. And you mentioned the best team shortage. Could you walk us through that?
So overpayments and underpayments are caused when someone, typically it has a dependent that is added or removed. And these best teams are set up to take those actions. But when I left, there were 5 best teams for the entire nation. And when you have veterans that are adding and removing, dependents for years, and then it takes 5 years for the VA to act on it, after they've already turned in their documentation showing that, hey, I divorced this person, and yes, they're still getting paid. But at what point do we blame the VA for this overpayment and stop blaming the veteran? And I want to point out, as many caseworkers here know, when this happens, it creates a debt that the veteran has to pay. And typically the government just takes it without even thinking about the consequences that it's going to have on the veteran and their families. Because a lot of these veterans, every single dollar is accounted for in their monthly budget. So if you remove $2,000, $3,000, $5,000, it's going to crash their budget, and then they can't pay their bills. So these are things like, that's something, if somebody is having a divorce or adding or removing a dependent, that's something that should be done via va.gov immediately. Stop it. If the veteran says stop on this dependent, stop it. Here's everything that's already there showing that this needs to be stopped, all the evidence. And then if it takes 5 years for the VA to look at it and confirm it, then that's what it takes. But in that meantime, the veteran isn't incurring a debt.
Right. And that makes so much sense. So we have kind of all of the pieces there to fix that. So we have the legislation that created the best teams and the rules about the overpayments, and then the data coming in from casework about, hey, this is how overpayment, or this is the overpayments that are being caused, and here's the impact on the veteran. And then your insight into, okay, but here's what's causing those overpayments, and the fact that we don't have enough best teams processing these, the fact that this process needs modernized. So we have all the pieces for kind of an implementable fix. It's just making use of this data and getting it to the right place.
Right. And having the right people look at it and say, oh yeah, that's a kind of an easy fix.
Yeah.
We can do that. We just have to commit to it.
Yeah. And then maybe before we move off the data question to talk a little bit more about just casework and tips for doing good casework here, I did want to circle back on that Office of General Counsel question. So can you tell us, so the context for this, I flagged in a recent newsletter, but we recently saw guidance from the Secretary of the VA's office preventing VBA employees from reaching out to the Office of General Counsel without prior permission. So can you just tell us, what does OGC do? What impact is that likely to have?
The Office of General Counsel represents the Department of Veterans Affairs on legal issues. That includes if a veteran is suing the VA. They are there to represent the VA and not the veteran. One of the issues that I ran into, and you and I had this conversation the other day, I had a case that had to do with Project 100,000. This is what the draft was called during the Vietnam War. And I found some legal issues that I needed assistance with. I needed to understand what I could tell the veteran and how I could help the veteran move forward. When I called Office of General Counsel, I was told, I put it in an email to them, attached all the files and said, this is my problem. And they said, well, right now you need to go get a lawyer because now you're a whistleblower. How is that helping the veteran? I need legal counsel, and I'm being told by the Department of Veterans Affairs as an employee that I need to go get my own legal counsel so that I can help this veteran navigate the justice system. How is that acceptable?
Absolutely wild. And then Office of General Counsel also, in thinking about representing the VA, and we're talking about interbranch connections here, they also provide guidance on Privacy Act release forms. And it sounds like that's been a bit
Yes,
of a problem.
that is a constant problem, because we keep getting back and forth information from Office of General Counsel with regard to how long a privacy release form lasts. Um, that's something I went to bat with them on a year ago, and the answer was a year. But then they couldn't give me any kind of formal guidance that I could push out to caseworkers. Well, caseworkers want to know what the law is and what the interpretation by the VA is. And quite frankly, I think that's fair. Why isn't the government doing that? Why isn't the government providing that information if that's what they're demanding of the Congress?
Definitely. And I know I can kind of feel the caseworkers on this call having a scream of anguish going back and forth on these Privacy Act release forms. But that's good to know that there is conflicting guidance. So talking about what is the most recent guidance from OGC could be a way for caseworkers to try to get to the most recent guidance, the most up-to-date guidance.
Yes. I would also say, kind of different from the privacy release form, OGC also authorizes and does all the security clearances for all the advocates working with veterans. And last I saw, they were about a year behind on that processing, which is a problem because these veterans are going to, the VFW, the American Legion, DAV, and applying for claims, especially after the PACT Act. And yet we have OGC stalling on, clearances for these people that are working with veterans. And what I don't get is that for myself as an employee of the VA, they contracted out with someone to do those clearances. Yet here we are doing them in-house through OGC for people that are working with veterans through the VSOs.
Okay. So then when folks are getting questions from your local VSO, your local DAV chapter, your local VFW, so that's kind of what's behind that delay, is that OGC is handling it in-house.
OGC is the problem.
Okay. Good to know. I know we could keep going on like the specific cases and the trends that you that you flagged for so much time. And so again, folks, we're going to have a lot of time for Q&A. So if there's a specific type of case, again, ground rules here. Jeremy can't speak to anything that happened after September of 2020. But yeah, we will have lots of time. If there's a specific type of case where you're wondering what's actually going on here, we'd love to get to those. So then just again, thinking about the utility of this data, one thing I wanted to just touch on for a minute here is thinking about the trustworthiness of this data. So again, we know that the people that come to congressional offices are kind of a self-selecting group. We've done a little bit of work on this in my other project for just looking at who comes to a congressional office. It's a self-selecting group. However, when we're thinking about the utility of casework data, the VA has had some quite prominent scandals where its own reported data has been falsified in the past. So as we're thinking about the usefulness of casework data, is this kind of helpful as a check and as a way to ground other sources of data the VA is putting out?
Yes, it absolutely is. Congressional data for all the casework, it quite literally comes from every congressional district and every senator for every state. So it's not, partisan. It's quite literally nonpartisan, and you're getting it from everyone, and you're getting a good example of what's happening across the nation. And with that, you can build on it and you can understand what's truly impacting our veterans, our survivors of veterans, and also corporations. I think a lot of people forget that as well. There are corporations out there that are often owed millions of dollars. Ambulance companies come to mind, hospitals that have provided community care, all these things. And you can start kind of putting together a picture of what visit is working correctly, what community care problems are out there that maybe we need to pay attention to a little bit more and clean up a little bit. Pension management center, I keep harping on that, I know, but quite frankly, I'm tired of seeing people evicted from nursing homes. That's not acceptable. So there's a wealth of data from across the nation, and typically the people that are reaching out to their members of Congress are at the last resort is where they're going, because they've already worked their way up through the regional office, they've already worked their way up through the medical centers and talked to them and didn't get anywhere. So then they go to their member of Congress and say, hey, this is my problem. The VA is not providing me any kind of substantial help here. Can you please help me? That's what you see. And that's also reflected in the data.
Definitely. And then also, I mean, congressional offices, so things that are specifically coming to the Office of Congressional and Legislative Affairs for congressional offices, as you said, some of those should be going to their local offices, but a lot are the ones that are not resolvable at the local office level. So those are kind of the gnarliest, most urgent, most difficult. So just again, thinking about the scale here, that's its own self-selecting data set, but that's still important for the issue. It's kind of self-selecting for the issues that are highest salience, that are hardest, they're most in need of
Correct.
reform.
The ones that are most needed as far as most impactful.
Right.
If you have casework, if you're doing casework and somebody comes in and says, hey, I'm having trouble getting a medical appointment, that is something that you should take directly to your local facility. And if you're still unable to get that medical appointment, then you take it to OCLA and say, hey, I tried to get it. This was the response. They said 60 days, and that's not what the PACT Act says. So can you help me out? Those are the issues that OCLA needs to be most aware of.
And that is so helpful. Are there any other kind of big categories of cases where you would say, hey, no, escalate this to OCLA? This is something that should definitely come up here instead of going to your local?
I would say anything that is life and death.
Mhm.
Escalate to the secretary's office, but also flag it in the subject line so that it doesn't get looked over. And quite frankly, if it's life and death, also CC the director, Anne-Marie Amaral, so that she has eyes on it. And if you need to, add the assistant secretary. I am not above escalating. I was never above escalating something all the way to the top.
Yeah, and that's really important for caseworkers to understand. You can do that.
Yes.
You're not going to break your relationship with OCLA by escalating a case that's worthy of escalation.
Correct. And as we were talking about this earlier, if you see something that just doesn't quite make sense, you can always say, hey, I want a higher level review. Can you, or not the higher level review that goes along with claims, but I would like for somebody like the Undersecretary of Health's office to look at this and comment on it so that we have a greater understanding of what's going on with our veteran. You can do that. You can ask for the Undersecretary of Benefits to respond. You can ask after they respond for the secretary to respond. You can do that.
So the toolkit might be a little bit wider than some offices have kind of
Correct.
ever tried.
Correct.
Yeah.
Correct.
So maybe backing up a step, again, thinking about the thousands and thousands of cases you've worked with and the hundreds of congressional offices, is there anything that stands out to you about just offices that were really great to work with or inquiries that were really easy to work? Is there just like things that stand out that might be helpful for caseworkers to keep in mind as they're working with OCLA?
So when people are sending us congressional casework, they need to make sure that they include the full Social Security number of the veteran. I cannot stress that enough. When we're looking at the Veterans Benefits Administration system and we're trying to look up a veteran, there's millions of people in that system. And if you plug in a name, a lot of times there's going to come back 30 of them. So it's helpful if you give us the full Social Security number up front, then we don't have to go back to, or they don't have to go back to you. You also need to make sure that VA is selected as the agency that is allowed to talk to you about the veterans issues. If it's Social Security Administration or the Treasury or whatever, then that's not going to allow us the opportunity to look into this person's case.
And that's on that Privacy Act release form.
Correct. Usually those Privacy Act release forms that all come from your offices or congressional offices, it's usually at the top, check VA. provide the staffer's name and contact information. I can't tell you how many inquiries I received, and I'm following up because maybe not everything's on the privacy release form, and it's sent from a email box that we can't reply back to, and we don't know who sent it to us. So I have to call the office, find out whose inquiry it is, talk to them, tell them what I need. And that's taking up valuable time, not only for the caseworker, but also OCLA staff as well, especially when they're doing 60,000 cases a year and there's only 4 people. So like those are little things that congressional offices can do that can make their inquiries move a little bit faster in the system. Include all relevant information. So if you have a hospital that is saying, hey, we have over $1 million that the VA owes us for patient care, then provide a spreadsheet of the patients, the amount, everything that will be needed for the billing office to do research on those inquiries. Oftentimes, what we were able to do, especially with corporate stuff like that, is get a healthcare team set up at the VISM level so that they could review everything and get responses back and money back into the hands of the community care providers. Privacy release forms for dependents. If you have a privacy release form for CHAMP VA for education benefits for the dependent, we need a privacy release form signed by the dependent, not just the veteran. And also have the dependent social security number on that as well, because everything's going to be under their social security number. VA does not accept third-party powers of attorney. That's something to keep in mind, nor does the Social Security Administration. So what needs to happen is there needs to be an advance directive set up before they come to us. So an advance directive can be signed through the social work department at the local VA hospital. And they can provide all the information on there as to what the family member is allowed to do and what decisions they're allowed to make. I think that's about it.
This is like the list I wish someone had given me when I was a new caseworker for the VA.
Well, I did put it in the PowerPoint presentation that our OCLA caseworkers are providing before I left. There was a whole list of things. I don't know if it's still in there. Yeah.
But at least we
don't know what's been changed after you left.
Of course, as always. And that is actually might be one other thing to ask for. Are there things that offices can ask OCLA for in terms of training or briefings that they may not?
Yes. They can ask for a briefing on casework. And there's a whole PowerPoint presentation that we would often give to Library of Congress.
CRS.
Thank you. Thank you.
Got you.
Yes. So CRS, we would give a lot of congressional inquiry or presentations to them, and also the Wounded Warrior Fellows. When they were coming on board, we would give them a presentation as well.
And that's on how to do casework or what's involved in casework or the data from casework?
All of the above.
All of the above. Beautiful.
I wanted to put it all out there so that everyone understood the problems that OCLA was facing, VA was facing, but also veterans were facing, and how to kind of navigate that process.
Got it. So then just reiterating again one more time on that data, this stuff is not secret, that it is out there.
It is out there.
OCLA is happy to provide, or was at one point happy to provide it. They have it.
I don't know if they're happy to provide it. What I can say is that the logs that we used, a university used FOIA to get them. So that is something that can be done. But I would definitely say Congress needs to do a congressionally mandated report and request all information on casework from OCLA.
And we love just free legislative ideas when they come out of these webinars. So I hope folks are taking notes. Wonderful. So I do see some questions in the chat, so I do want to move into those. But maybe before we do, I wonder if we could just talk again, zoom out just a little bit and just talk about the experience of working in this office. So we talked about, I know for my team, when Jeremy, when you and I worked together when I was a caseworker, we sent you the toughest cases, the kind of case that I still remember the veterans face today. And so you were handling those cases for 441 offices. And as you say, with a shrinking team and an increasing workload. So clearly this job takes a toll. This can't be easy work. So are there
Okay.
things that Congress can do to support OCLA and support the work that you guys did, that the office continues to do to help veterans?
Yes. One thing that OCLA needs is more appropriated full-time employees for casework. Um, it's not feasible for right now. It's 3 people working cases. The deputy director they hired isn't doing casework. So you have Alma Bourne, Michael Bordeaux, and Christina Smith, whom are all great in their own respect. But when you are receiving, 100+ cases per day, you can't keep up. And I understand OCLA is able to get a lot of stuff done and help a lot of people, but it's not feasible for those individuals. And they're being asked to work overtime. Well, a lot of them were already working overtime. And when I got overtime authorized for the team, when I was acting deputy director, when I went to ask for it to be paid out, it wasn't paid out. So, it definitely is something that Congress needs to look at, because you have all, now only three caseworkers, CLA working 60,000 plus cases annually. And as Doge comes in and wipes away 1/5 of the, employees at VA, that's going to create even more problems, because now you're not going to have the people that need to process the claims. You're not going to have the people to provide health care to the veterans that need health care. You're not going to have the administrative staff to back up the health care folks, to schedule appointments. Like, that's just not feasible, especially after implementing the PACT Act and you have all these other folks coming into the system.
Fair. And we've talked about this from the congressional side so many times that good or bad, disruption at an agency increases. Usually, if the agency is not able to handle the number of calls coming in, those spill over to Congress. Congress tries to go to OCLA to resolve those inquiries. And if there's not capacity at OCLA, we've got a problem.
Correct. And I think Congress really needs to take a look at their whistleblower laws. You and I have talked about this. In 2019, I became a whistleblower, just happenstance. And I spent $20,000 over a 2-year period on legal to fight the government and do what was right by the veterans. And, that's kind of difficult for me. And I made a decent salary. And you have all these people at the lower levels in the hospitals that are seeing problems. And maybe there were people in Phoenix that were reporting problems. But if they're, having to pay for their own attorneys, it becomes very difficult to fight the government.
Definitely. And then that harms Congress's ability to kind of get those whistleblower, like the insight from those whistleblower inquiries. Well, okay.
Right.
So again, we have a few free legislative ideas that we've surfaced here to support OCLA. So I really appreciate that. And let me say again, Jeremy, thank you for all the work that you did. It was just incredible to be able to work with you in my office. I know many other people on this call are grateful for that service.
Thank you.
All right, let's get into some questions. So we have some in the chat. Let's start with the first one and circle back to those flags on medical records for disruptive behavior. So Eric says he was told there was an appeals process. How should offices handle those disruptive behavior flags?
The appeals process is something new to me, because when I was there in September, there was not an appeals process. If you want to appeal something, I would say send it to first the hospital figure out what they're going to say about the veteran that they place a disruptive behavior flag on. And then when you need to escalate it, take it to either the VISN or OCLA so that they can put it through to the VISN.
Perfect. Super helpful. Thank you for that. Oh, we have a question from Paulette asking, what else can we do for veterans if their files are burnt? Oh my gosh, I remember these.
Oh gosh.
At NPRC, they are trying to get VA healthcare and benefits.
So NPRC typically tries to put things back together. You can also go to the Veterans Branch of Service, let them know that the files were burned so that they could do research themselves on when the veteran was in the military and everything. Unfortunately, with burned medical records, there's not a lot else that you can do. And that's something that Congress and society as a whole needs to determine. And unfortunately, a lot of these people that had their records burned are Vietnam veterans. And they were all victims of Project 100,000.
Fair. Okay, so that one may be a good example of something to talk to your legislative team about big picture solutions there. Awesome. This is maybe a really good one. So Eric asks, can you give a general time frame for how long a basic claim should take? So what are some examples of things that will increase the time for a case to be adjudicated? I think there's a lot to unpack there.
So most claims, if everything is there, and I'm going to base like myself, and I've done everything not to get VIP care, and I haven't. But typically claims, if everything is there, like you hand them the connection, the medical records from the military, and then you hand them the private sector medical records, everything is there. It typically takes about 6 months for a claim, a regular claim. Now, if you have a whole bunch of issues, like some people have 20 issues that they're claiming, then that's going to take a lot longer. And that's because they're having to look at every single issue and back it up with medical records from the military, and then compare it with private sector medical records. And then you have the CNP exams. So then the rater has to go back and look at everything. And unfortunately, there's a national rater shortage, which is slowing things down. So I would say 6 months to a year is the normal time frame for a regular claim.
Okay, that is super helpful for level setting. Awesome. And I will say, I'm going to leave this up in the Q&A so that people can take a look at it. Really helpful flag from Rebecca, or actually I'll drop this in the chat. So Rebecca from the House Office of Whistleblower Ombuds reminds me that their team has a fabulous resource guide around VA whistleblowing. And they are a wonderful resource for folks who have further questions about whistleblowing, resources for VA whistleblowers, folks coming to Congress, how Congress can handle those specific whistleblower outreach that comes into their office. So Rebecca, thank you so much. I should have flagged that earlier, but we really appreciate
awesome.
You guys being here. Perfect. Okay, so that's in the chat for everybody. Wonderful. So that's super helpful for level setting, just on baseline, how long should things take? And you mentioned the rater shortage. And when you and I chatted before, you also mentioned that there were some issues with the national work queue.
Quite literally, claims get stuck in the national work queue. It's a process that needs to be cleaned up. And I know Christy and I would go back and forth trying to figure out how to get a claim pulled out, and we just couldn't. And we would go to VBA and say, hey, this person's claim is stuck. It needs to be adjudicated. Everything's there. What's going on? And it's just stuck in the system. It just, yeah.
So just put a finer point on what's happening there then. Okay, so veteran submits their claim for compensation and pension. It goes into the queue to be worked, and that queue is supposed to assign it to raters. There's a rater shortage, and so it just stays there without anything.
Correct. It just stays there for months, sometimes completely ready to be adjudicated, but it just doesn't get assigned to anybody.
Do you have a sense for how many cases get stuck that way?
Thousands.
So
that I've seen. over the years.
This might be explaining a lot of the things that come into congressional offices where it's, hey, where's my case?
Right.
It could be one of the stuck ones. Okay.
Right.
Folks, if you have other questions, please feel free to drop them. We have another couple of minutes. In the meantime, again, Jeremy, you and I talked about another issue. I wonder if you could just talk through a little bit, which is foreign medical care reimbursement.
Foreign medical care reimbursement, as well as CHAMP VA, both have major issues with personnel. There's just not enough personnel. And with foreign medical program, there's also an issue with people. We don't have personnel that can interpret the language from the country. And one thing that I hate about the foreign medical program is that the veteran has to pay for their care up front, and then they're reimbursed. Well, they may not get reimbursed for a year. And then how many, times do they see the doctor since then? And so it's just kind of like this snowball effect where you have CHAMP VA and foreign medical program office, and they don't have the resources to do the job. And quite frankly, that's something that private sector industry would be better at running than VA.
Got it. Okay. Super helpful. Again, I hope this is helpful for folks. It's just as you're getting these inquiries in, for putting a little bit of meat behind, okay, what is actually happening here? And again, those structural, those implementation challenges that show up in casework. So I think that's always helpful. At least I always found that helpful when I knew what was happening, helped me write the inquiry better, or at least what I knew could be happening always helped me write that inquiry better.
Right.
I hope this is helpful. If folks have other questions, and if not, I'm just going to keep going.
It's all good.
So Jeremy, you and I had also talked about Voc Rehab or VRNE. And I remember this was a huge questing beast for my team, that we get a lot of these issues. And again, talking to you, you helped me put those pieces together for what's actually happening. So what's going on with VRNE?
So VRNE has always been a problem, and I went through VRE to get my degree. Problems, the counselors have way too big of a caseload, kind of like CLRs and OCLA, just way too many people. And then you have antiquated, outdated computer systems that they're using, and they actually have to go in and release everything for every single veteran. And instead of having, a computer system where maybe the school sends a note to VA to say, hey, this is what's going on, and the VA approves it, everything has to be done back and forth via email. And that's not really a good way of managing workflow, especially at the national level, especially in, the government's second organization with the second largest budget. That's just not reasonable. And if they could fix the computer system, that would probably alleviate a lot of the problems that the caseworkers and the veterans are both finding themselves in.
Got it. Okay. And again, just free legislative ideas here.
Yes.
This is awesome. We have two other questions, and I think we'll try to get to both quickly before we go ahead and wrap here. So Maggie comes back to the VA RMC and the records management CDs issue and says, I know our office has also come across that and their delays weekly. What is the latest on that conversation? There may have been MilCon VA language. Jeremy, do you know if there's any movement there?
I don't know. Again, I've been gone since September, so I don't know what's going on with that.
Totally. And I know this year, because we're in the CR, some of the stuff that was supposed to be in FY25 may not be in there. So that would be a really good one to check with your legislative team, Iman. And I know programmatic requests for this year for FY26 have just opened. So maybe a good one just to talk through, hey, what can we do to keep pushing this? Perfect. Okay. And then someone anonymous asks, is there any way for veterans to request their claim be handled with another RO? I've had vets express they feel there's a bias against them at a specific RO and wish for their case to be worked elsewhere. Ooh, good question.
I have come across that many times. The national work queue sends it out to everyone to be worked. So it's not specifically being worked by their local regional office. You can request that through, casework. Hey, can we work this outside of the Atlanta RO? I'm just throwing something out there. you can ask for that, and then VBA can look into that and see what needs to happen.
Okay. Again, thinking about the toolkit for casework, that is something you can ask for. That's really helpful.
You can
Oh,
always ask.
yeah.
The worst they can say is no.
Love it. That is such a good mantra to keep in mind for casework. We have two others, and really appreciate all the questions, folks. Paulette asks, how should we advise veterans who are dissatisfied with their C&P exam? They have comments, want VBA to be aware. Should they appeal? Should the office submit an inquiry?
Um, I would say they should submit an inquiry before they appeal. If a C&P exam needs to be redone, then it's best to get it on the front end before taking it to the appeals process. Everyone on this casework call knows that the appeals process is just a bottleneck system. And the Appeals Modernization Act, when they created the higher level review and the supplemental claim, that was just another bottleneck system. And it was interesting when that was being implemented way back when. One of the people that was part of the team putting it together, actually said to me, I don't think this is really going to help much for the greater appeals process, because quite literally it's just creating another path for these appeals to go through. And then once they go through the higher level review and supplemental claim process, if it's denied, then they're going to go over to the regular appeal system. So I could go on for days on that.
I know, but this is, again, one of those examples of, hey, if the folks writing that legislation had gone to talk to or had better mechanisms to ask the people who work on implementing the law as it is, like, we would have probably gotten some really good insight into how this was not going to be helpful.
Correct.
It affected how that law was written.
Correct.
Got it.
Here we are.
But here we are. And then last but not least, Caitlin asks, is it worth it to reach out to the Records Management Center directly, or should we direct RMC questions through the VA off OCLA?
I would say direct them through OCLA. Last time when I was there, they had stopped taking congressional inquiries at Records Management Center for a little bit. I don't know if that's still the case, but I would say one or the other. Don't choose both, because if you're doing both, then you're duplicating the work.
That is great
Keep that
advice,
in mind.
John. Perfect. Awesome. Well, thank you. Thank you so much again to everyone who joined. Thank you for asking really wonderful questions. And Jeremy, again, thank you. Thank you. Thank you for all of your work in OCLA, your service to VA, your service in general. I know you're a veteran as well. We're all so grateful to have you as a resource, and definitely glad and grateful for you joining us today to share some of this insight. It's such a privilege. It's such an incredible opportunity to get to ask some of these detailed questions in this setting. So thank you. We really appreciate it.
Thank you for having me. This was fun.
I hope so. And I am seeing some thanks to you come in through the Q&A too. So I know there are so many grateful folks on this call. Perfect. Okay, as we wrap up, as usual, just a flag for folks, all of our, this has been recorded, and we're going to put this up online if any of your colleagues weren't able to be here. All of our casework resources, including our past webinars and this one, are at popvox.org/casework. If there are other topics you're interested in, or if are any other ways that we can be helpful or be a resource to you, again, at this time when casework is so crazy, please don't hesitate to let us know. I am always reachable at ANNE@popvox.org, and always happy to chat. So thank you all again so much for taking your time today. Hope everyone has a wonderful rest of their Thursday.